Welcome to the S4OM S4OE Speaker Spotlight Series. These short conversations are designed to introduce you to the brilliant clinicians, educators, and researchers joining us at the summit, not just for what they teach, but for who they are. Today, I'm joined by Nicola McGill, and I'm so excited for you to hear their voice and perspective before the event. Welcome, Nicola. I'm so glad you're here with us today.
Thank you. Thank you for inviting me.
So before we talk about your session, I'd love to just ask a couple of questions about you. What keeps you passionate about the work that you do?
The ability to help people and support people on their journeys and seeing the outcomes of the work. And even if it's just making that very subtle change and a subtle difference to their quality of life, you feel like you're doing good. It's very empowering to feel like, okay, my knowledge that I have spent numerous years kind of training for is able to now actually put people in a place where they can feel a little better. And even if that's just it's addressing pain, it doesn't always have to be this big, significant change, just subtle changes. And then you think, okay, this works. And it inspires you to do more.
Absolutely. Can you tell us what first drew you into this field?
Well, my initial training was as an aromatherapist, which I took my training back in the UK, and I had an instructor who utilized manual lymphatic drainage in our aromatherapy practices. And I just was very intrigued by the lymphatic system, how it worked and how it functioned, and just the subtlety of the work. And then that led me into, because of the gentleness and the subtlety of the work, led me into the field of oncology support, working in a hospital environment where they were looking for support for oncology patients. And I was really able to bring manual lymphatic drainage into the mold as well as my oncology massage training. So I have my original aromatherapy instructor way back in the late 80s she was that inspiration. She was the one who touched on it, introduced it to me. And ever since I've just been very intrigued by the lymphatic system.
That's wonderful. And I'm sure as an educator, you inspire so many other people.
I try. I think I do. I mean, I don't want to be kind of too much out there, but yeah, I just having just taught a class in California, everybody's like, wow, I've got so much now I can do. And it's like you're passing the baton on and just continuing to inspire the therapists to do the good work that we all do.
Yes. And there is so much good work to do.
Yeah. Yeah, there is.
So let's talk a little bit about your session that you're going to have at the summit.
Mhm.
So I love the lymphatic system. I'm fascinated by it. And I'm always so amazed at how the information is so rich in the field of massage therapy and so lacking in other areas. So I guess I'll start with that basic question. Why is the lymphatic system so misunderstood in medicine as well as in oncology?
I think, I mean, from what I'm gathering from people that I've spoken to in the field, and I've had some in my classes that I teach, I've had some nurses, I've had some physicians who say that within medical school, it is literally 1 or 2 days that covers the role of the lymphatic system and what the lymphatic system is. Whereas all the other systems are so well researched and the knowledge database it is huge. So I think there is a lack of that initial awareness and training around the role of the lymphatic system in initial medical training. Even with when it comes to physical therapists and physical therapy school, they're very limited on their knowledge around the lymphatic system. So in particular, when they take one of my classes or any instruction around the lymphatic system, it's completely eye-opening and just recognizing that it's not just about edema. A lot of people think it's just fluid that's building up in the tissues and it's a waste reduction and waste removal system and detoxification. But there's so much more to it because that lymph fluid that is being moved around plays a vital role in the sustenance of life. And I think as well, some people think about it relating to the immune system, but I just think it's just been a lack of knowledge and awareness. and I don't want to speak out of turn here, but I certainly believe that in the European model, this is something that's been around for a very long time. If we look at the Vodders who developed manual lymphatic drainage way back in the early 1930s, it took a long time for it to transition across the pond, shall we say. And I think now people are more and more aware of it. And I think hopefully we'll see more research. But I think the key point here is it's not well studied and well understood, and not enough research, shall we say, for sure. Yeah.
That's so true. That's so true. What's something that you think massage clinicians, that they think they know about the lymphatics that is actually inaccurate?
I think the key thing is that a lot of people consider, oh, the lymphatic system, oh, that's about waste. There's an element to it that's true, because there are a lot of waste materials that end up in the body that need to be removed. A lot of people use, misnomenclature around detoxification, and lymphatic system is not about detoxification. Your liver is your key organ when it comes to detoxification. So I think a lot of people think, okay, if we just move all this fluid around, we're going to be, detoxifying the body. But generally, the lymphatic fluid that our body is working through 24/7 and removing contains many components that are essential to life. In particular, the proteins that end up in our tissue spaces, we need to recirculate them, almost like we're recycling them, because many proteins are required for so many different bodily functions. And I think as well, a lot of people don't realize the important role that the lymphatic system has on our digestion. That's another thing that goes nobody really thinks about that. I do think there is that element. I think for oncology massage therapists who have been introduced to this more subtle, gentle, nurturing form of massage can appreciate the gentleness of the work with the lymphatic system. But for people that haven't kind of gone into that area of learning, they still feel that the deeper, more vigorous tissue techniques, massage techniques are still moving lymph, but they're not. They're kind of creating the lymph as opposed to actually fully moving it. Whereas with manual lymphatic drainage, it's more specific, where you're enhancing and you're mimicking the action of the lymphatic system. So I think there's a lot of misrepresentation around, oh, any kind of body work is moving lymph. But it's to understand the true anatomy and physiology. It's like, well, yes, you're creating it and the body has to remove it more. But when you're doing manual lymphatic drainage, you are specifically working with the anatomy of the lymphatic system. There's things there coming into play, I think.
Definitely. So what would you say to clinicians who feel intimidated by this work?
Education, knowledge. Education and knowledge is the power to be able to know what you're doing safely and not be afraid of the work that you're doing. Even for me, as somebody that's been doing this work for 30 years, I'm still always learning. There's always a condition that comes into the ground of, like, a client has this kind of situation. I have no idea what that entails. Does it involve the lymphatic system? I'm not sure. So I do my research and learn. But I think that's the thing, is like understanding, reading, platforms like S4OM that provide all these educational summits and educational classes. It's like, learn. We never stop learning. And I think and as an instructor, just the power of, like, people having the knowledge, they feel that they can go out and actually work on people safely because they've had the education. So I think the key thing is education. Don't be afraid of the system. There's lots to know about it. There's times when you can do the work and times when you can't, just because you're moving fluid throughout the body. But if you have the information and you have the knowledge, you can do wonders. You really can.
Yes, I love that perspective. I think that's so important.
Yeah.
So thank you for sharing that with us. I can say that I am truly excited for your session. I think the work that you're going to bring to the summit is really exciting and wonderful. And I just can't wait to hear your presentation.
Thank you.
This is just a little glimpse of what Nicola is going to bring to their session. And we're really excited for you to experience it in its full depth and breadth. So we'll see you all at the summit. Thanks for listening.
Thank you.
If this conversation resonated with you, it's just the beginning. This episode is part of our Healing Summit speaker series leading up to the 2026 Virtual Oncology Massage and Aesthetic Healing Summit, happening on April 26th. Each week, we're sharing conversations with our speakers, offering a deeper look into the work, the perspective, and the heart behind what they'll be teaching. If you're feeling inspired, I invite you to join us live. It's a full day of learning, connection, and collaborative growth in oncology-informed care. You can explore the full summit and save your spot at s4om.org. Until next time, thank you for being a part of this community and for the care you bring into the world.